Welcome to the Senior Focus. I'm here with Donna Osterguy. We're going to talk about a lot of very interesting things today. Hello, Donna. How are you?
Good, Nick. How are you?
I'm okay. I thought the first thing we'd talk about is the heart of the matter.
Our symposium.
Our symposium.
Our symposium. Very excited about it. We are having our symposium on June 20th at Holy Cross College. And it's a great day. We're very excited about it. We probably have almost 100 participants signed up so far. The hall, I believe, the Hogan Center can hold up to 300. So we're certainly taking anybody who is interested in coming.
Well, if someone was interested in coming, how can they
get information?
Yeah, get information. You know, you have to reserve.
You do. You have to reserve a spot. We have a lot of people who come the day before or the day of and want to come. It's for people who have already signed up, and that's the key. But we still have plenty of spots available to anybody who would like to attend our symposium, June 20th. You would just call our office, 508-755-6525, or visit our website, www.edlalaw.com, to sign up.
You know, what happens oftentimes is people think that there's no pressure, there's no hurry, they wait, and then at the very last moment they try to attend and they find out that there isn't adequate space for them. There, in fact, is no space for them.
That's what happened to our Alzheimer's symposium last November. We had over 278 people attend. It was almost beyond the maximum fire code for the Beechwood Hotel, which was difficult.
Well, when you think of 278 people attending, plus all the people that are there to provide information, the exhibitors that man the booths, I mean, we're talking a lot of people.
It was jam-packed in there.
Jam-packed, it was.
And we had a lot of people who showed up that day of our event. And I know that we have begun running commercials on Charter3 TV for our event, and there's the ways to sign up are either through the telephone, calling our office, or signing up on our website. We have a total, honestly, of 4 symposia a year. On our website, you can sign up for our extra 2 that we still have yet to do. One is September 18th, which again, College of the Holy Cross. That is on focus on joint replacement and advancements in arthritis. The latest treatment and advances in arthritis and joint replacement. And our last one that we do during the year is on Alzheimer awareness. It will be our 2nd annual focus on Alzheimer awareness, and that is on November 7th. You have the ability, if you go to our website, to sign up for either all 3 of these or pick and choose whatever best suits you.
I know that, you know, we've said that people tend to wait till the last moment. There's not, you know, a lot of space, so you have to reserve early. And I said that a lot of people think, oh, there's no hurry, this is enough space for me, and they call at the last moment. I'm kind of traumatized because at the Alzheimer's symposium, people called and I answered the phone. They were crying. They wanted to come, which sounds kind of funny, but I suppose
no, not to someone who really needs that information.
Somebody who really is desperate to find out and finds out that they can't attend because there's no space, and then, you know, they started crying, telling me how important it was that they go, and it was like, you know, it was sad.
The big thing that's so important, I believe, about this one is learning about the latest and greatest advancements in heart disease. As you age, so many people at some point in their life end up with some form of heart disease, whether it be through genetics, through your family history. It doesn't mean that you're not the perfect, we'll say, person of eating healthy, exercising daily, not smoking, not drinking alcohol. All of those risk factors, even if someone is that healthy, it doesn't matter. Sometimes it's in your genetics, in your family history, that your parents are predisposed to it. You end up with those same exact, we'll say, diseases, difficulties. You have ability to come to this and learn from the leading experts in this area on heart disease, on what the latest advancements are, new drugs that are out there to treat heart disease, new, we'll say, arthroscopic surgeries where they're minimally invasive to help you deal with the issues of heart disease.
And you know, it's not really just experts in the area or local experts. The people that will be presenting was the UMass hospital. What they ranked, like #2 in the country for heart health?
They are.
I mean, that's a tremendous,
and
tremendous
#1
achievement.
for surviving a heart attack in Massachusetts. So basically, it's a question of you're able to come to this event and hear about the latest and greatest advancements and information about heart disease and stroke prevention. So that's the beauty of it.
As far as the exhibitors, there are going to be exhibitors there, right?
There are,
Approximately how many?
I think, maybe 20, about 20. We're
About
trying to
20.
lessen it a little. The reason that we go with less exhibitors is because of the fact that we can have more attendees. And that's our goal. Our goal when we present these symposia is to allow as many people, the general public, to come and hear from these great experts. And the more, we'll say, exhibitors that we have, various organizations and companies that come, the less people we have. So we're trying to limit it, honestly, to about 20 vendors. But 20 vendors, honestly, who are there for the people with community resources. There are different companies, everything from, we'll say, VNA Care Hospice, Independent Healthcare, Tatnick Park, which is an assisted living, Dodge Park Day Club, Acclaim Home Healthcare, Care Solutions, all these various companies that either offer services that you end up with a stroke or you end up with a heart attack or heart disease and need services in your home or even outside of your home. These services are available, and you'll be able to visit each one of these booths, talk to people about what their services are and what they can offer, and also sign up for free raffle prizes, which is a little extra thing. Each booth that will be exhibiting brings a raffle prize. You sign up for it and find out great information that's in your community so that people are able to stay at home, not necessarily go to a long-term care facility and have to go to a nursing home. Ways to stay in your home and live with things like heart disease or stroke.
And it's a completely free day, isn't it?
It is. Doesn't cost anything for parking, for lunch, for raffle prizes, for hearing these great speakers.
So if someone were interested in obtaining information, but they're thinking, you know, if I attend, if I go, I don't want to spend money. I don't want to, you know, be tried, you know, be sold a bill of goods when I go there. That doesn't happen at all, does it?
No, it's not about, there is no selling concept here.
Right.
When you go, you are getting free information from literally the latest and greatest experts in the field. They're up there providing free information to tell you how to live well with heart disease, how to possibly, we'll say, change your lifestyle if you have some lifestyles that we know that aren't good for heart disease. Have experts there. I can tell you that Dr. Robert Phillips, he's going to be speaking on advances in the diagnosis and treatment of heart disease. Who wouldn't want that, honestly? I want to know what the latest and greatest, because if I'm going to end up, and who knows, I mean, my parents are predisposed to it, I may end up with it. My key is that I want to learn the best information I can to arm myself with whatever the future brings for me. And if that brings heart disease, which I hope not, but if it did, I know what the greatest and latest things are out there for me to be treated. If I have a stroke, or if I'm a caregiver of my mom, if she had a stroke, which you never wish on anybody, but if it did happen, I would know that there's a stroke clinic at UMass that offers incredible services, that offers the latest and greatest, again, on how to recover from a stroke, how to prevent a stroke. We have Dr. Moonis presenting that day on how to prevent a stroke. It's truly preventable, and many people don't know that.
And he's the director of the stroke clinic?
He's director of the stroke program for UMass Memorial Healthcare.
Okay, okay.
So, among many of his titles, that is one of them. Professor of neurology, psychiatry, tons of things.
And it's not just information from the presenters, there's information from all the exhibitors.
There is.
And what kind of information might someone get there? Like you go to a booth,
I'll give you an example. If someone had a stroke and they
Yep.
needed services at home, they don't want to go into a long-term care facility because they maybe have some paralyzation on one of their sides, can't, we'll say, read, write, whatever it takes, whatever happens after the stroke. There's programs there are companies there that offer, whether it be support services, programs, whether you, and this is an instance we see quite often in our firm, we'll call it adult day health, where someone can go and stay all day long if that spouse still has to work, if that family member who can't care for them at home is able to go to a day club, whether it be Summit Elder Care, which has the PACE program, whether it be one of the home care companies, Care Solutions, Acclaim Home Health, one of those that can offer services in their home so they can stay there. No matter what it is, whether you've had surgery, I'll give you an example. If you end up with open heart surgery, when you come home from a hospital, you're going to need services. You're not going to be able to go home and do what you did, say, 10 years ago. It's a different concept now. Now you're looking out for your best interest of your health. You may need services at home. All of these companies either offer at-home services or services that can be honestly catered to someone who's had heart disease or a stroke.
And once again, contact information for people that are interested in attending the event?
They would call our office, 508-755-6525, or visit our website, www.edlalaw.com.
And again, the cost? There is no
Free.
cost.
Free for everything. Free whole day. I tell people, if you can have something free and take advantage of it and learn so much more, knowledge is power, you say it all the time. That's the key. They get to go and hear the greatest and latest advancements in stroke prevention and heart disease. What more can you ask for? And everybody ages. At some point, you have to face these facts.
You know, another thing, people might be thinking, well, you know, I don't have heart disease. I haven't suffered a stroke. You know, this isn't for me. Is it only for people who have a heart ailment or who have suffered, you know, the effects of a stroke?
The key here is that people think that they have to wait for the catastrophic event. We see it all the time in our office. You don't wait for it. You get knowledgeable before you get the information that you need, the education that you need to understand that whatever lies down the road, you'd have it. And that's what we want. We're not saying people who haven't had a heart disease, had stroke, had a heart attack, or any of those things. We welcome them to come because they may find out new information that just came out that they may not even be aware of. We're saying that this is for anybody who thinks about the future, maybe has a parent who has heart disease or high blood pressure, all factors leading to heart disease. And stroke prevention as well. The key is that you can come and learn about this in advance. And I'm a firm believer in education to the highest level in terms of, even if it comes down to an event like this, you've armed yourself with more information to walk away and make a decision and say, geez, I'm going to change my lifestyle, or I'm going to add this to it, or maybe I need to ask my doctor about this particular drug that may help me in many areas, not just one.
So it sounds an awful lot like whether it's Medicaid planning, estate planning, legal planning, rather than waiting until it's, you know, really late in the game. The more you find out, the more knowledgeable you are about a particular topic, the better, and the sooner the better. Rather than waiting until it's too late to do something, the more you can arm yourself with this information, the better off you are.
It is. We say it all the time, Nick. We can never say it enough, but I just want people to know this is a free event for them, so please call, sign up for this event.
And it's at Holy Cross.
Holy Cross.
And what time does registration begin?
Registration actually will begin at 8 o'clock, between 8 and 9. We'll have coffee. They can visit a lot of the booths that will already be open as of 8 o'clock. 8:30 is typically when booths will be all manned and ready to be viewed and sign up for the raffles. I'd say 8:30. Between 8 and 8:30, we'd like people to arrive 9 o'clock promptly, and I mean promptly. We begin the day because I know how easy it is to fall behind like we have in the past ones, where sometimes the speakers take a little bit longer, or maybe there are questions that are so important for people that we don't feel, because there is a question and answer period with this after each one of the presentations. Well, shall I say the morning presenters and the afternoon presenters. We will have the ability to ask these doctors specific questions. So the morning presenters will have a period where they'll all speak for 30 minutes or so, and then we go right into a question and answer period.
And I bet all these doctors want to stay on time too, because I
they
presume
do.
they're tremendously busy.
It's difficult,
and
honestly.
we're fortunate that
we are
making time to be available to come in and talk about these things.
I can't say enough thanks to these doctors who come and present these free services for people. This ability to come and talk to, say, 300 people and have them all wanting to hear about the latest and greatest advancements in their field.
And
So,
what time will this go till?
it'll go till 3 o'clock. Hopefully by 2:30 we'll start pulling the gift raffles for all the attendees, and by 3 o'clock everybody will be done. And the lunches are fantastic. I can't say enough about how great, you'll tell everyone how great the lunches are at Holy Cross.
I have, and I will. They really do a tremendous job with the food service.
What a beautiful spread of food. It was just a wonderful day.
And after the Heart of the Matter, there's another one coming up on
There is September 18th.
arthritis and joint
Yeah,
replacement.
it's focus on joint replacement and arthritis.
And then we finish up the year with another symposium on Alzheimer's disease.
Alzheimer's disease.
We're going to head to a break right now. When we come back, on the other side of the break, we're going to talk about the Be Organized, Be Prepared kit that we offer.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Please join us on Wednesday, June 20th at the College of the Holy Cross for a special day for anyone interested in learning more about the latest information on heart health, such as heart disease risk factors, stroke prevention, and how you can implement a heart-healthy lifestyle. Help the American Cancer Society save lives and create more birthdays by joining the Relay for Life of Worcester, sponsored locally by Charter Communications and Charter 3. Relay is a unique community overnight event that allows teams of families, friends, and co-workers to join together in the fight against cancer. Form a Relay team this year and make a difference. There are 14 relays taking place throughout Central Mass this year. For more information on a Relay event in your area, visit cancer.org and register your team today.
I'm Tom O'Donnell, Chief of Police for the town of West Brookfield, with an important safety message. Studies have proven that texting while driving is dangerous and has led to fatalities. Is taking your eyes off the road to read or respond to that text message worth the risk of getting into a car accident or worse? Be smart behind the wheel, not only for your safety, but the safety of others. This safe driving message is brought to you by the Central Massachusetts Chiefs of Police Association and Charter Communications.
Join me on the Hank Stoltz Experience. You know, people are always asking me, what is the experience? Well, that's the beauty of it. It's everything that has to do with Central Massachusetts, from the politics of the region to the great events that are going on each and every weekend or every night right here in Central Mass. It's everything that's going on. It's everything that you want to know about. And just like Kelly Square, where the traffic never stops, we never stop either. There's no red lights on the Hank Stoltz Experience, only on Charter TV 3.
I'm Kristen Doucette from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. I have with me Dr. Majaz Moonis. Hello, Dr. Moonis, how are you?
I'm fine, thank you.
I said that we were going to talk about the Be Organized, Be Prepared kit, but I don't want to talk about that right now. I want to keep talking about the heart of the matter, heart health, and specifically I want to talk about strokes. I suppose first I want to ask you, how long have you been a physician?
Oh, about 25 years.
About 25 years, long time.
Okay.
What drew your attention to the practice of medicine?
Well, primarily the fascination for the brain, and that when I started out there was very little known about the brain, and in some ways I was fascinated by anatomy, and that led to the natural, progression to.
As far as clinical interests, I was surprised when I saw that one of your clinical interests is Alzheimer's disease. When I think of stroke, I don't think of Alzheimer's disease. Is there some correlation between the two?
Yes, there is. I mean, it's probably a very complex correlation, but I'll try to simplify it as simple as I can. So what happens with patients with Alzheimer's disease is that you get deposition of this stuff called amyloid in the brain and other things, and that destroys the brain cells slowly. And it does it about 20 to 30 years before you actually start developing any symptoms of Alzheimer's disease. Now, on top of this process is in itself driven to some extent by how your blood vessels are doing. So, you know, some of it is genetic, but otherwise the state of your blood vessels has a lot to do with how you are doing. So, if you, let's say that you have mild Alzheimer's disease and you get a stroke on top of it, you would suddenly become from mild to very severe. Right. You know, the cognitive decline becomes very, very, very accelerated. That's one of the things that happens. The other thing is that if we look at brains of patients who've had Alzheimer's disease or so-called Alzheimer's disease, we don't really see just one pathology. We see as the Alzheimer's pathology, which is what I described just now, and then we also see multiple small strokes or blockage of small blood vessels. So what we are leading more and more towards is a concept of what is probably called a mixed dementia, meaning that it's not neither this puristic Alzheimer's disease or pure stroke related dementia, but that the two processes come together.
It's a scary thing for me, and I'm sure for many people that are listening, maybe for everyone that's listening, to think that there can be a process that's occurring in your brain that is affecting you and you don't know it. There are no signs, no effects. It's going to affect you many, many years down the road. I find that to be a frightening, frightening thing.
Certainly. And it's very true. Interestingly enough, not everybody who develops the amyloid process or the Alzheimer's process, so-called Alzheimer's process, becomes demented. It depends on how long you live, how much you accumulate, where do you accumulate that burden of disease, right, in your brain. So if most of it is in the memory area, then you're affected much earlier. If it is in other areas, then there are different manifestations. But we actually tried to look at this hypothesis that patients who are normal functioning people, who are bankers, lawyers, etc., but who have the gene that makes them very prone to Alzheimer's, they will definitely get Alzheimer's disease. We started looking at their spinal fluid and the clinical evaluation, and we found that in those people who are pure pathology, I mean there was no stroke or anything else, they were young, 30, 40-year-old folks, and there what we found was that they had the manifestations in the spinal fluid of Alzheimer's way before they even became demented. So yes, I mean, it is a scary thought. Can we do something about it at the moment? We can image your brain, which makes it even worse, because people are trying to see if there are about 3 FDA approved dyes now that can be, you can have a PET scan and you can have the burden of disease being seen in a live brain, pretty much. Right. But what happens there is that if you can see that all the amyloid is accumulating in the hippocampal region or the memory area, then you would obviously be more likely to get the disease.
Now, we hear, talk about a stroke. What is exactly, what is a stroke?
So stroke literally means, sudden something that happens to you, which affects. So, and there are 2 types of strokes. Basically, one where blood vessels are blocked in your brain, and the block could be because a clot broke away from your heart and went and blocked the major blood vessel of the brain, and that happens very rapidly, and one of the worst kind of strokes that you can have. But you can also have blood vessels here in the neck block off and suddenly cause loss of function in the area that we were supplying. So that's called ischemic stroke or the blockage kind of stroke. Right? The second kind of stroke is when you have sustained high blood pressure or brain aneurysms or which make the blood vessel wall weak, and it ruptures because of the high sustained blood pressure. And when the blood vessel wall ruptures, it causes a huge amount of blood to go into the brain and destroy brain tissue. And that's called a hemorrhagic stroke.
Now, I always thought when you talked about stroke, or I always thought it was like an oxygen deprivation, and it happens because not enough oxygen gets to your brain. Is that right? Is that wrong?
That's absolutely true.
Okay.
But what happens is that the oxygen deprivation, even if when you faint,
right,
your oxygen levels go down. I mean, that's blood flow goes down, oxygen levels go down, and you faint.
Right.
But you recover because the moment you hit the ground, the blood flow starts again into, and right, you're back to your normal self. In this particular case, the blockage doesn't go away unless rarely it goes away on its own. So in most cases, there's a blockage, and because of that, no blood flow, and therefore lack of oxygen. Now, nature has provided us with a number of different arteries that compensate for that in some ways, if you're lucky. And if you have that sort of circulation, then part of the brain can be saved, because even though this particular artery is blocked, the remaining arteries
will carry the
blood to that place.
What about risk factors?
Yes, and that's perhaps the most important thing to recognize, that all our risk factors, in fact 90% of the risk factors for stroke are present way before you ever get a stroke. Most people don't recognize them because they don't produce any symptoms. Mm-hmm. For example, the major risk factors, apart from the non-modifiable, we divide risk factors into modifiable risk factors and non-modifiable risk factors. For example, age, female gender, then these are some risk factors that you can't modify. But you can certainly modify blood pressure, so high blood pressure, high cholesterol, diabetes, obesity, sleep apnea. These are all risk factors that are that slowly build up in time and either block off arteries or cause coronary heart disease, which then leads to a...
So there are a number of different things that a person might have, yes, that will lead them to a higher probability of a stroke.
What about the difference too, doctor, of is a man more susceptible to a stroke or a woman? Is there any risk factors more for women than men, or vice versa?
Women are more susceptible to stroke, firstly because they live longer, secondly because they, to a certain stage in their life, they're protected by their hormones, and then they lose them. Unfortunately, if you restart hormone therapy at a late state, meaning over 65, then you double the risk of stroke, and that's a paradox. So the hormones are protective in your early life, and yet when they're gone and you try to replace them at a later stage in life, it becomes a problem.
More troublesome then. So you'd say basically then, is there anything in a we'll say the non-modifiable ones, could that be genetics as well? Because if you're like my parents are predisposed and had high blood pressure, and now, not that I have it yet, but would that be a factor for me as I age? Are these things that, say, someone could go to, like, we'll say your clinic and find out about? Is there ways to literally prevent a stroke from happening if you were early enough to, say, do the preventative measures?
Absolutely, absolutely. I mean, that was the whole basis of starting a stroke prevention clinic. And the concept is that look at every risk factor, see what can be modified, and then try and treat them aggressively so that the progression of the disease doesn't occur.
We're going to have to head to a break right now. When we come back, I do want to talk to Dr. Moonis about the clinic and get more detailed information about the clinic.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Please join us on Wednesday, June 20th at the College of the Holy Cross for a special day for anyone interested in learning more about the latest information on heart health, such as heart disease risk factors, stroke prevention, and how you can implement a heart-healthy lifestyle.
When we walk together, we are bigger than cancer. Join the world's biggest fight for more birthdays, the American Cancer Society Relay for Life. Find your community's event at relayforlife.org.
Charter Business helps businesses achieve everyday victories. Want to be victorious today? Call 877-BIZ-BUNDLE. Switch to Charter Business and start saving over $50 a month. You'll enjoy internet 6 times faster than standard DSL, plus phone with unlimited long distance. Saving your business over $50 a month makes for an easy decision. It's indecision that'll cost you. So call 877-BIZ-BUNDLE today. To the victor go the spoils.
Maybe I was too harsh on the Worcester City Council. I said maybe. I mean, when they're talking about raising chickens and stuff, maybe we shouldn't have been so harsh on them. Maybe what we should be doing here is expanding, not only chickens. Maybe let us have a cow in the yard. Maybe a couple of pigs, a goat. That way we'd be sure there'd be no pink slime, no glue in our meat. This is sad.
I'm Caitlin Tivnan from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. I'm here with Dr. Majaz Moonis and Donna Ostagai. Of course, I'm your host, Attorney Nick Kaltsis. And, we were going to talk about the clinic, and we are going to talk about the clinic. But one of my pet peeves, smoking. People don't, I guess, people who smoke, maybe they don't understand the serious nature of the problems that they're probably going to encounter down the road. And I would assume having a stroke or becoming susceptible to a stroke is one of the very terrible things with smoking.
Absolutely. What smoking does is it causes damage to your blood vessels. I mean, that's the key. And what it does is it not only affects your risk of heart disease, stroke, but also what is known as peripheral vascular disease, meaning that when you walk, your legs will start hurting. And in due time, if somebody is really susceptible to it, they could get so much decreased flow in the legs or the arms that they might not need amputation to save their limbs because there's no blood flow.
And I would assume that, as with pretty much every medical issue that we've talked about, exercise is a good thing for people.
Absolutely. I mean,
so many people think I'm too old to exercise or I'm too infirm to exercise. That's not true.
That's not true at all. The recommendations of the American Heart Association are that whatever, if you can exercise, if you can walk 5 miles, great. But keep one step in front of the other as much as you can, and you would make a difference.
So it's like do as much as you can.
As much as you can.
You don't have to overdo it, but you can do something, and every little bit helps you.
Yes.
I remember when I was in a wheelchair and my physician said to me, Nick, you've got to exercise. And I said to him, Doc, I'm in a wheelchair. There's nothing I can do. And he said, no. We start slowly. You only do what you can, what you can do. And before you know it, before I knew it, I could do a lot. Right. Just start slowly and move into it.
Right. And most people who think that they're overweight or they cannot exercise because of A, B, C, D conditions, if you start slowly and slowly build it up, you'll be surprised and amazed. I mean, in fact, there are programs the American Heart Association offers, which are called, Olympic training programs, in the sense that, you come to us, we'll take care of you, we'll even, put you up and train you, and then you can go train others, too.
Now, at the clinic, we're going to talk about the clinic. Is someone able to come in, are they able to get this kind of information at the clinic? Can they begin or be helped along with, we'll say, a course of exercise or?
Absolutely. So when people come into the stroke prevention clinic, the focus is both on education, evaluating the risk factors that can make them more likely to have a stroke, and effectively and aggressively treating them with the best possible medications. So just to give you an example, I mean, everybody says, fun example is that you take an aspirin, and when you fail an aspirin, which means you get another stroke because the aspirin didn't work, then you take one of the more expensive drugs, B or C.
Right.
My theory is a little opposite of that. I mean, you should start from the best, treat everybody as aggressively as possible, and prevent that first stroke if you can, or reduce the chances of having that first stroke. Because once you've had a stroke, it may be a major, one, and you may be bedbound for 6 years, 5 years. Who knows? I mean, what will happen?
Is the clinic at UMass the only one in this area? Would say that I have a stroke and end up at a hospital. Would you say that in this area is the stroke clinic, or the one that you have at UMass Memorial, is that one where you'd be able to be treated for the stroke, maybe have surgery if necessary, almost like all in one time, instead of being sent to, say, Boston or somewhere else? Your clinic has the ability to treat the whole process itself.
Absolutely. What we have here, and some of the other smaller hospitals are trying to set up similar models, because is that you can identify and treat medical risk factors aggressively, and then if there are surgical issues involved, for example, if you have a blockage of a neck artery which is more than 70% blocked, the best medical management is not the same as the best surgical treatment. So you would want to send them for surgery, and we have a network of people right within the hospital, and we refer them in real time, very quickly, for those kind of
because I mean, if you were diagnosed with a blockage, that would mean at some point a stroke could occur. Is that correct?
Absolutely.
And so the key is, in a sense, time essence, that you have it checked, taken care of, monitored, make sure that the blockage, say, isn't above 70%. If it is, then you do what's necessary to maintain that you don't have the stroke at all. So that's the goal and the key within the stroke clinic.
That is the goal. And because, again, as I pointed out in the beginning, that most people do not recognize that they have risk factors, and some that don't want to do anything about them because of maybe habit, maybe. What we see mostly in the stroke prevention clinic are people who already had a stroke, so they don't, to prevent the second stroke. And to give you an example, the national average for stroke is about 4.5% or so, or a little higher in places. But in the last 10 years, our stroke recurrence rate is only 1.7% per year. So which is literally 1/3 the national average. And the reason, there's no magic to it. It's just that every time we follow patients every 6 months or a year, depending on how complex or severe the condition is, and make sure that every little piece that could possibly, cause or be a risk factor for stroke is aggressively addressed. And then you follow them and make sure that they, it's one thing, we have to get into partnership and to build that partnership and
work to prevent another stroke, in all honesty.
Absolutely.
And that has to be someone's biggest fear, is that when it does happen, will it reoccur again, and ways to prevent.
Yes, absolutely.
And that's your goal as, stroke clinic, to work with that. And that would be, I think, the most important thing. When we have our symposium, I'll let our viewers know that Dr. Moonis will be part of our symposium. His title of his presentation, which is so perfect, is "Stroke is a Preventable Disease and Prevention is Better Than a Cure." And it really is. Why have the stroke if you can prevent it from ever happening? Right. And that's probably the big goal. I would think, as a person, I wouldn't want a stroke, so if there's ways to prevent it from ever happening, that would be the goal.
Could we prevent it 100%? Probably not. But could we reduce the chances tremendously? Yes. And there have been the best example is when people get these reversible strokes or mini strokes, sort of, as they're called. If you catch them at that point and aggressively treat them in the hospital, identify the cause of what's happening and treat them aggressively in the hospital, you reduce the chances of their progressing to a stroke by 80%.
So they've come, I think, I remember years ago my grandfather or my grandmother had a stroke, and in a sense there was nothing left to do at that point, but that was probably 30 years ago, 40 years ago.
Right.
So I think that now they have come so far with medicine or treatments or whatever it be. When you have someone who experiences a stroke, comes in, and you find that there's ways to treat it before it's going to be a full-blown stroke. Is that what you're saying?
Well, there are two things that I'm saying. First of all, if we can prevent that from happening with all these measures that we talked about, that's the best way, because that will make the biggest difference to the largest number of people. Once somebody gets a stroke and they're actually coming in with the blocked artery, then it's really speed is of essence, and if you can safely unblock that artery with clot-busting drugs like TPA, etc., or even go with a catheter and pull out the clot. Those are the kind of things that we do for acute stroke. The returns on acute stroke are not that high as prevention. I mean, you could literally say that the difference between prevention and cure is 100 to 1. So, but even that 1% difference is tremendous, and it's important. So that if somebody does have that problem, UMass happens to be the only hospital that actually has a dedicated care plan, so that if somebody hits the door with an ambulance, or sometimes they walk in not realizing they're having a stroke, we have very set care plans, and it's treated almost like a heart attack. So a code stroke is called, and a whole team descends down there, takes the patients to the imaging center very quickly, and decide on the management plan. And as long as you can do that in an organized way, and not just rely, because this drug TPA is commonly in most other centers given intravenously only. We do that too, but we knowing if there are large arteries that are blocked, we know that the chances of that making a difference is only about 8%. So in those cases, we'll start the drug, but we'll take them right to the catheter in interventional suite, so that they can somebody can go in there and actually suck out the clot, because this is not going to be effective.
It's like I say, knowledge is power. You go to the clinic, you can find out information on the ailment instead of waiting for something terrible to happen to you. And if it's preventable, the more you know about it, the better off it is for you. Instead of waiting until something happens, it's just like anything else in law, I suppose. The longer you wait, the worse off it is for you. By the time you ultimately react to something, it's too late. Better to be proactive and do something before you have to than to wait for an event to occur. We're going to head to a break right now. When we come back, I do want to talk a little bit about the heart of the matter and Dr. Moonis' presentation.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Please join us on Wednesday, June 20th at the College of the Holy Cross for a special day for anyone interested in learning more about the latest information on heart health, such as heart disease risk factors, stroke prevention, and how you can implement a heart-healthy lifestyle. Help the American Cancer Society save lives and create more birthdays by joining the Relay for Life of Worcester, sponsored locally by Charter Communications and Charter 3. Relay is a unique community overnight event that allows teams of families, friends, and co-workers to join together in the fight against cancer. Form a Relay team this year and make a difference. There are 14 relays taking place throughout Central Mass this year. For more information on a Relay event in your area, visit cancer.org and register your team today.
I'm Tom O'Donnell, Chief of Police for the town of West Brookfield, with an important safety message. Studies have proven that texting while driving is dangerous and has led to fatalities. Is taking your eyes off the road to read or respond to that text message worth the risk of getting into a car accident or worse? Be smart behind the wheel, not only for your safety, but the safety of others. This safe driving message is brought to you by the Central Massachusetts Chiefs of Police Association and Charter Communications.
Join me on the Hank Stoltz Experience. You know, people are always asking me, what is the experience? Well, that's the beauty of it. It's everything that has to do with Central Massachusetts, from the politics of the region to the great events that are going on each and every weekend or every night right here in Central Mass. It's everything that's going on. It's everything that you want to know about. And just like Kelly Square, where the traffic never stops, we never stop either. There's no red lights on the Hank Stoltz Experience, only on Charter TV 3.
I'm Kristen Doucette from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. I'm your host, Nick Kaltsis, and I'm with Dr. Majaz Moonis and Don Ostagai. You know, one of the things I was interested in, as far as the presentation that you're going to give at the Heart of the Matter, is there some particular information that a person can walk away with that will help them paint a picture of what is it like if you have a stroke?
Sure. In other words, I mean, some strokes can be very subtle, but fortunately most of them are very obvious. And to recognize a stroke, one needs to remember 3-4 important things. The first is it's sudden in nature. So you have a sudden onset of something going wrong with yourself, you know. And it could be sudden loss of language, so you're not able to speak or understand. You could have sudden weakness of the arm or leg. You could have numbness of one side of the body. You could have difficulty in walking, which was not there before. I mean, you were walking fine, you're walking down the street, and then suddenly you become, you know, shaky. So these are the major, and you can have sudden loss of vision, like a shade descending in front of your eye. These are all signs of or symptoms of stroke. And so if you experience any of them, most people have this tendency of calling the doctor or wishing it away, or saying that, let me call my PCP right now and see, what advice would he give. No, I mean, the answer is call 911 and get an ambulance right away, because the sooner you get to the hospital, the better your chances are of getting better treatment.
Now, when you say sudden, what does sudden mean?
Sudden essentially means that I'm fine now, I'm not fine now. Okay. It can be that fast.
It's like seconds.
Is it that distinguishable, though? I mean, that you'd actually know it, or could it be subtle? Would you say sudden? And I'm trying to.
So the subtle parts, subtle strokes are there, but they, fortunately, I mean, they in the long run they can cause dementia or memory loss or things like that. But those subtle strokes that do not cause overt symptoms, then do not affect your day-to-day functioning immediately, in most cases. Mm-hmm. And that's what people call mini strokes, or those kind of things. But these sudden, when I say sudden, I meant really an acute event occurring within seconds to minutes. And so there are a lot of other conditions that can also present like this, like low blood sugar can present like that. You can suddenly lose half the strength in half your body. You could have a migraine that can present like that. You could have a brain tumor that has bled and presented like that. So there are a number of other conditions, but that's our job. I mean, so your job is to recognize that these could be symptoms of stroke. Okay, the moment you get to the hospital, our job is to within a span of less than 20 minutes to be able to figure out what do you have,
and treatment of that,
and then go straight right into the treatment. Not every minute. You will be surprised that every minute that you waste in thinking about things or wondering on what's what, mm-hmm. you lose 2 billion neurons in your brain.
Wow.
So,
are there any symptoms that are more common than others, whether it's problems with speech, lack of memory, eyesight, balance? Is there something that's more common than the other?
Yes, I mean the major strokes, the ones that really put you into a nursing home if not treated, or worse, would present with acute or sudden onset of weakness of one side, with language difficulty and drooping of the face on the same side. So language, as you know, comes from the dominant part of the brain. So there is a non-dominant part of the brain, or what is known as the right side of the brain or the left side of the brain. But that's a distinction. Most people have the dominant part of the brain is the left side of the brain. And so strokes affecting the left side of the brain can be very devastating in terms of this. On the flip side of it, the right side of the brain is used to recognize space and everything around you. So if for example you get a stroke on the right side of the brain, then you lose the rehabilitation process becomes very difficult, because you tend to ignore a lot of space features on the other side of the space. So if you have a right-sided stroke, somebody standing on the left side could be non-existent. You may be talking to me and I would not notice you, and you would walk around over this side and you would talk to me and I'll notice you.
Right.
How about clinical trials, Dr. Moonis? Is there any clinical trials right now available for people?
There are several clinical trials going on, and some focusing on different aspects of how to treat stroke. So some are medical drug-related trials. There's a trial that is going on, which has a long window, which is very good, of extracted bat saliva that acts like TPA, but can act up to 8 hours. So if somebody has a stroke at 7 hours, it's not hopeless. I mean, people sort of give up at 4.5 hours or 5 hours and say that, you know, beyond that is, but no, there are these other options. And in a trial, the only thing is that you may or may not get the medication, but that's the nature of the trial. But there are other trials of which we are doing that involve laser therapy. So you give laser to the entire brain to try to power up the remaining dying cells. And that seems to have made a huge difference. As far we are still blinded to it, so I can't say who got treated or didn't get treated. But of the 16 patients, or 14, 16 patients that we have done so far, they all came back to the clinic to see us. So
wow, that sounds promising, though.
And that's up to 24 hours. So think about this, that, you know, it's not hopeless. I mean, nothing is hopeless, and you should, if you cannot get into acute treatment for some reason, then there are other options which are interventional options. If you can't get interventional options, then there are options of clinical trials.
So many of the things that we've talked about here today, you will be presenting at our symposium on June 20th.
Right.
That's such exciting news.
Yeah,
I'm very
definitely is.
hopeful of what you're talking about right now, especially with clinical trials. You don't know how far they'll go. It might be something that will be right around the corner for us in the future.
Yes.
Hopefully.
Yes, I mean, that's certainly true.
If anybody would like to contact Dr. Moonis at his office, the phone number is 508-334-2527. That is at the Stroke Prevention Clinic.
That's the number that will get eventually to me.
To be able to get an appointment with you.
Right.
Okay. And for anybody that would like to attend a free symposium June 20th at Holy Cross College from 9 to 3 p.m., please call our office 508-755-6525 or visit our website www.edlalaw.com.
Dr. Moonis, I want to thank you for joining us today. There's a lot of really helpful information. People need to be proactive. They need to listen to this information and then act on it rather than just waiting in denial until something happens to them.
Well, thank you very much for inviting me.
Thank you for coming in. Donna, as always, thank you.
Thank you.
Thank you.
Thank you for joining another episode of the Senior Focus, and we will see you next week.